Assalamu alaikum doctors. In this video I am again telling a consent scenario. That is a splenectomy consent. Suppose the case is like hereditary spherocytosis. He needs require much more repeated blood transfusions. So consultant has decided to do the splenectomy. We have to explain all these things and take the consent. So suppose, hello Mrs. Salma, I am Dr. Emma, one of the doctor here. I guess you are Alice Mammy, is not it? Yes, doctor. So it is really my honor to sit with a keen mom like you, and I know you are doing great job in taking care of Ali. Thank you, doctor. So with pleasure, ma'am, I am here to talk to you about some of the plans we took for Ali, and hopefully at the end of this meeting we take your consent. Okay, so what is the plan? Okay, I will explain for you everything, but first, do you need anyone to be here? No. So tell me, how much do you know about Ali's conditions? I know he is having hereditary spherocytosis and he is having increased blood transfusion requirements. I wish there is a solution for that. Actually, that is why I am asked to talk with you about a procedure called splenectomy. Have you heard about it before? No. So it is a procedure done under effect of sleeping medicines and done either by open surgery or keyhole surgery to remove an organ located here pointing to your spleen side. This is called spleen. Are you with me? So first of all, we are splenectomy procedure. How can we do that? By under sleeping machine, open surgery or keyhole surgery, we remove a organ pointing over the left side of abdomen, the spleen. Yes, doctor, but why? So why we are doing this procedure? We are doing this procedure, as you know, hereditary spherocytosis is all about abnormal shape of RBC, and the spleen is the organ that distracts and kills that abnormal cells. So by removing the spleen, we will decrease the destruction and we will decrease the blood transfusion requirements. Am I clear? So we know that hereditary spherocytosis, there is abnormal blood cells. So by that procedure, and spleen is the organ who is remove the abnormal blood cells. That's why repeated blood transfusion needed. So if we do splenectomy, then this abnormal blood shape will be not be removed. Yes, doctor. But some drawbacks, obviously we tell that. But ma'am, let me explain for you that for any procedure there are benefits and risks. First of all, there is a risk of sleeping medicine, but it is given by an expert specialized doctor in giving sleeping medicines to the children. Also, there is a risk of catching bugs, but no need to worry as it is done under complete cleaning measures. And there is a risk of bleeding, but it is done by expert hands. Definitely, there will be some pain, but painkiller will be given to him through the procedure and afterward. Are you with me? So the procedure risk we tell and also the solution. First of all, it can be sleeping medicine side effects, but expert doctor are going. Pain can be occur, we give the pain medicine. Bleeding can be occur, we interfere immediately. Bleeding medicine, these are we are doing, and also infection, catching bug, but it is under septic environment we do. Yes, doctor. Also, the important we tell that also spleen has another job in our body, that it has a defensive role against the germs and bugs that enter our bodies. But we will overcome this problem by giving him some certain shots. Also, it is better to avoid infections. He will take antibiotics for life and he have to wear a bracelet. Am I clear so far? So spleen organ functions we will tell. First of all, it has defensive role against the bugs. So splenectomy occur, he can easily can be infected. That's why he need to take lifelong antibiotics. Another thing, he need to take some vaccine or shots, and he should be avoid the infections. Yes, doctor, when we will take this shot? Within 2 weeks before the surgery. So within 2 weeks before the surgery, remember 2 weeks before the surgery. So how long he will stay in hospital? Actually, the best one who can tell you is the surgeon. So how long he will stay at home? It is better to stay in home for 1 month and avoid contact the sports for 3 months after the procedure. Okay, doctor, should I decide now? No, you can take your time. I will give trusted website and some written leaflets. If you have any further questions, we'll be here to answer you and we are waiting for your response as soon as possible. So some important advice. First of all, spleen is an defensive organ, so lifelong antibiotic he need to take one things. There is he wear bracelet, he avoid crowded and he take the shots vaccine that will take before 2 weeks of the procedure, and after the procedure 1 month he needs rest and 3 months he avoid the outdoor sports because thank you.